To health matters now. The latest outbreak of Lassa fever in 4 states has led to the death of a total of 21 persons. The states are Enugu, Ondo, Kano and Delta, where several cases are being monitored by surveillance teams and others receiving treatment and measures being put in place to prevent further spread of the disease. For now, Kano State has the highest number of cases being investigated, with the Commissioner for Health, Aminu Sayawa, putting the figure at 292.
Now let's know more about the situation in Enugu from the Permanent Secretary of the Minister of Health, Ifeanyi Agujobe.
A confirmed case of Lassa fever in Enugu State. Unfortunately, the patient as we speak is dead. It is a 75-year-old woman from one part of the state. He is admitted in the Enugu State University Teaching Hospital, Parklane, about 10 days ago. A sample was taken from this patient yesterday to virology center in Outbreak in Ebonyi State. The result came this morning, and unfortunately, it was confirmed to be a case of Lassa fever.
In Delta State, health facilities have been placed on red alert, and the other case, a co-member is responding to treatment. Ikena Amechi brings us updates.
This is where the woman infected with Lassa fever disease died after testing positive to the deadly virus. The core member is also undergoing treatment in this facility, and thankfully, he's responding to treatment. At this press briefing by the Ministry of Health, the Commissioner confirms the cases and assured the people of containment of the outbreak.
One of them is a woman from Osisa. And whilst the result of the blood test was being awaited, she passed. The result came after death. The other younger fellow, who I'm told works here, is a copper. For every case identified, there's a surveillance placed on the contacts of that particular case. And that is ongoing right now. Contact tracing and surveillance. They're put under watch to be sure that symptoms are not developed.
Lassa fever can be transmitted to humans through multi-mammate rats. Most cases occur in rural communities where rat populations are high and hygiene and sanitation conditions are poor. This latest outbreak in the state calls for concern, and the government wants the people to be aware of what to do to avoid exposing themselves to the disease.
Beyond the opening of the isolation center, the Ministry of Health has also deployed the officials to sensitize our people and continue that sensitization, which is with a view to preventing further outbreak. Good enough, one of them is responding to treatment, but unfortunately one has passed. And what is most important is that we are taking steps to ensure that it doesn't spread and that it does not go beyond these 2 cases. We are convinced that with what they have put in place, that our people do not have any reason to panic.
2 cases of Lassa fever in these states, with one dead and the other responding to treatment. But the ministry is also on the lookout for these 2 people are in contact with. Hopefully, they will nip it in the bud and ensure there's no spread of this virus. Ikena Amechi, TVC News,